And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress. We're coming to you from Washington, D.C. And a very special welcome to those of you who are joining us virtually. I'm so pleased to have in our studio Pramod John, who is the founder and CEO at Vivio Health. And we checked in with Pramod last year. Let's get the update this year. How are you doing?
Doing very well.
Yeah.
Thank you, Mabel, for having us again back on stage. So thank you for that.
Well, I see you running around having a lot of meetings, which is a different experience from what we had at last year's conference. What's changed?
You know, I think for having been that we launched with the product in the early part of last year to where now we have proof points and we've got customers that have been doing extremely well with a new program and a new way of doing things. I think we have a lot of now proof points behind us. So it's a very different conversation than a year ago.
Right. And what kind of data are you putting in? Are you seeing real impact from some of the strategies that you've put in place?
Yeah, absolutely. Our customers are seeing a huge reduction in their spend on specialty drugs, both on the side of the acquisition itself of these drugs because of our alternative contracting model.
How are you achieving this? Describe some of the models that you have in place.
You know, one of the things that right now, one of the problems with the industry is that the current contracting model is the same whether you bought a cheap generic drug or you bought a very expensive specialty drug. It would be sort of like saying that you and I in our daily lives would buy lettuce and our cars in exactly the same way. And that's the way the drug contracting works today. And clearly, as we all know, you know, how we buy cars and how we buy lettuce is completely different because the supply sides are different. And in the same way, when we look at the specialty drugs versus most of the drugs that we acquire, it's very much the same thing. And our contracting is 3 decades behind, even though you know, the supply sides are completely different. And so we've changed the model for how we contract on those things, how we acquire them, how we think about formularies, how we think about a lot of the conventional wisdom. We've gone back and said those things were really created for something, a problem from 20 years ago. And with this new specialty drugs today, they don't work. They're not optimal for that. And that's one of the reasons why people pay so much.
Well, why would pharma companies want to change what they've been doing all along? What are the benefits to switching to what you're doing?
So in general, the truth is that pharma companies aren't that excited about changing the things and the ways that they're doing things because they're highly profitable and successful. Some of the ways that we contract and other things really benefit them more than the buyers of these things. And so for the first time, we're saying, well, we're going to look at this from the perspective of the people who buy, not the people who sell. And a buyer's perspective is very different than a seller's perspective.
Sure.
And while you may want to charge a very high price for it, as a buyer, we want to ensure that you're getting a fair value for what you're getting. And today there's a disconnect between those two things because of the way that the market works. And we're trying to change that by representing the people who buy these things. So from that perspective, it isn't necessarily true that pharma is excited, but some parts of pharma are excited for new models. And those are the parts of pharma where imagine that you're the new vendor as a new drug, but you can't get it to market because it's excluded by formulary, even though it's lower cost and it's a better drug than what's on market. And so today, a lot of those things are prevented from getting into market. For example, AbbVie's new drug for Hep C, Marriott. Very difficult for them as a result of the fact they have a much better, much lower cost drug than the competitive product from Gilead, Harvoni, but they're excluded from most of the formularies by PBMs.
Now, you've done some specialized work in oncology. What's happening there?
Oncology is a really interesting space and one that we've in some ways wanted to avoid because of primarily because in oncology today a lot of the decisions aren't driven by data. They're driven by our emotion and fear of things like death, which rightfully so as an individual, most of us don't want to wake up one day and learn that we have cancer and are facing an uncertain future. And for those reasons, often the decisions that we make are really disconnected from the data itself. And when you look at there have been a lot of studies that have come out over the last 6 months specifically looking at, for example, a lot of the blockbuster drugs in oncology. There was a BMJ article which pointed out that when they had reviewed 68 of the big blockbuster name drugs that we see, and they found that in 34 of them there was a 0. We're not even talking about whether we believe that a 8-week life expectancy increase in life expectancy is good or bad. We're talking about 0. We're talking about drugs that are being used where there's no indication at all they provide any value or life extension to the person who's on it. And we also see the part of the problem there also being the FDA, because the FDA now has the lowest bar, if you will, on approvals or data for approvals, specifically in the area of oncology. So we see drugs that have less than a 2% rate of response in a population being approved by the FDA.
And do these drugs, if you had more data, would that not happen?
Well, I mean, I think there's definitely the question of more data, and we could make better decisions. But our bigger problem today isn't the lack of data. It's we're not using the data that we already have. So we could be significantly better just using the data that we have today if we were to use it. And our focus as a company is not only to collect data that might make us better in the future, but saying, well, we could be significantly better than where we are just with the data that we already have.
You recently had one of your customers win an HVA award, a Health Value Award. What's the story there?
So this was, as it turned out, it was our first customer that we launched with in January of 2017, CHG Healthcare, based out of Salt Lake City, Utah. And they're a really interesting company because they've got about 9,000 members. They are also on the Fortune 100 list of best places to work in America. And so you can imagine for an employer like that, they are very concerned about things, not just about cost reduction. Ultimately, they're more concerned about things like the member experience. Are our members going to be happy? Is it better for our members? Is the experience easier for them? And what's interesting about them is that not only did they win the Health Value Award because of all of the money they saved, their members are significantly happier with the experience because what we're doing is much simpler for them than the way that it used to be. And so we're very excited about the success they've had both financially and from first-time program being implemented, a new program. And as a startup, it's always hard to find customers who are willing to say, I'm going to do something and think differently about something. And they're one of those companies that said, we want to do something and try something different.
Well, what was your pitch when you first got them on?
When we first got there, our pitch was that we could save you potentially a lot of money on specialty drug spend. Because when we started out, that was primarily the focus. And we made the pitch that we can make it better for your employees. But of course, that hadn't been proven because at the point that they started, they were our first customer. So it was really a pitch saying, hey, we believe we can do this for you.
And do you recall what they were doing and what you went in and overhauled?
Yeah, I mean, what they were doing looks like pretty much every employer in America. They've got a few plans. Some of the plans, they've got pharmacy carved in with their carrier. Imagine some of the largest carriers in the U.S. And they've got plans in which they've carved out to an independent PBM. And we've carved out specialty out of all of those. And so they look like pretty much every company in America that traditionally has a benefits program. So they're very similar to everybody else. And so from that perspective, our program would work anywhere, right? That for any self-insured employer, because they were so vanilla in the way of what they were doing today when we started.
And we hope to see you next year at this conference. Have any predictions on what your life is going to be like in the year running up to next year's conference?
I think it's going to be, based on what we're seeing this year, it's going to be significantly more customer traction, on the customer side. Much better a product, because as a company, our focus is also how do we make the product better every day. And so if you were to look at what we were doing, just even in a year ago versus today, much, our numbers are improving, if you will, day over day. And so that's a big focus for the company and delivering more value to our customers. And personally, that just means a lot more airplane time, spending time on airplanes. So.
Well, we're lucky to get you next year, really. Thank you, Pramod.
Thank you very much.
And I'm Mabel Jong. Thank you for watching. Stay tuned.